Hi friends, I am Dr. Richa Malhan. I am a resident doctor in Obs and Gynae department in SGT Medical College, Gurgaon, and I'm here to talk about the effects of coronavirus on pregnancy. So I'm particularly going to deal with all the pregnant women out there who are expecting soon and their family members, and also couples who are planning a pregnancy right now or in near future. I think you all will be able to benefit from this video, right? What I'll be covering in these videos is what are the steps that you can take to prevent coronavirus in you, and when exactly to visit the hospital. So we all are aware that you must be visiting hospital as less as possible at this time, because we are flooded with corona suspect cases and positive cases at this time, and in case you visit the hospital, then there's a greater chance of you being infected. Also, we ourselves as doctors are exposed so much that we are scared to go home every day, meet our family members, our kids. It's because there's so much infectivity with this virus that it is very easy for an infected person to spread it across to other people. And that is why I hope all of you are staying at home and you're maintaining hygiene, hand hygiene, washing hands very frequently, and you're maintaining other kinds of hygiene. For example, the cough etiquettes. I am sure you all are aware that in case you are feeling like coughing or sneezing, you should not do it in the open. Okay, if you're feeling like coughing or sneezing, do not do it in the palm of your hand. Also, you should be using either a tissue paper that to dispose of properly in a dustbin, or you should be cuffing in the elbow. Okay, if you cuff in your elbow, there's a lesser chance of this area being in contact with the surface, and if that doesn't touch a surface, it is not going to spread. Unlike the palm, if you cough on the palm of your hand, you're more likely to touch it with to another surface, and then somebody else touches it and the virus keeps spreading. So I hope we are able to break the chain. We're able to control the virus very soon, and until then please reduce your hospital visits unless they are very urgent. In this video I will tell you when exactly you should be visiting the hospital. It has been reduced down to bare minimum. I'm quoting the guidelines from the World Health Organization and also the latest guidelines issued by All India Medical Institute, AIMS, Delhi. So according to that, you should be visiting the hospital to a bare minimum of 4 times only. So earlier we used to be telling you that once you know you're pregnant, you should immediately come to the hospital, get yourself tested for UPT and blood tests and urine tests, and then there is an ultrasound scan. So all these tests are still very important. See, you should not continue your entire pregnancy sitting at home and not getting tested at all, because you might miss out on a lot of problems that might have come your way, and if they're not detected, they will not be solved. There are situations when your pregnancy can lead to some physical problem to you or the baby. The baby might not be viable, or your pregnancy might lead you into some serious medical illness that must be detected timely to save your life. Okay, so please do not understand from this that we're telling you not to visit the hospital. In pregnancy you must visit the hospital, but please reduce the duration, right? You don't have to visit the hospital as soon as you know you're pregnant, as soon as the UPT kit has come out to be positive. The first step when you will come to the hospital will be at 12 weeks. Okay, so as doctors, we count your pregnancy in weeks. The 9 months are about approximately 40 weeks of pregnancy. So in these 40 weeks, the first 12 weeks you can sit at home. All you will suffer from is a little bit of nausea and vomiting. We're all aware that that is common in pregnancy. Everybody does suffer mild to moderate levels of nausea and vomiting. Nausea is the feeling that you're about to vomit, or you're going to throw up, or you don't feel like eating properly because of it. Vomiting, of course, you know, there is vomiting in pregnancy. Some women don't experience it at all, whereas the other women who will have vomiting, say 2 times, 3 times, or 5 times a day. Even episodes of vomiting up to 8 to 10 times a day are normal if you're able to do other activities, if you're able to do your household chores, if you're able to work, if it does not disturb your normal life balance, then it is absolutely normal. Okay, you don't have to worry. But in case it is causing you so much weakness to a point that you're unable to do anything else, you're unable to interact with your family members, you're unable to do very normal routine household chores also, then you must visit the hospital immediately. Otherwise, you can visit us at 12 weeks of pregnancy. Now, why 12 weeks? 12 weeks because, of course, we need to run your baseline level of blood test and urine test. In blood test, we'd like to rule out all the viral markers. We want to see if you've not been carrying HIV or hepatitis or syphilis, all these kind of viral infections. We want to see what is your blood pressure like, if you're a diabetic already or you've just developed diabetes because of pregnancy. And we'd also like to do your urine examination. Also, in pregnancy, you're more susceptible to have urine infections, so we'd like to run those tests. After that, I'd like to do an ultrasound. This is the first basic ultrasound that is needed. Okay, so in this ultrasound, I'd like to see if your baby's nasal bone, this bone, has been formed properly, and I'd like to see this part of the fetus, which is called nasal translucency. Now, why these two things are to be seen precisely is because these two are abnormal if your baby is structurally abnormal. Okay, so if these are normal, then there's a lesser chance of your child being structurally abnormal. And in case this problem does arise, if in case we see that the bone is not formed properly, then we'll advise you further test to find out what exactly is the cause for this problem that has arisen. Okay, and in case this is all normal, then we will move forward from all normal tests that are being done at this time. We've also seen that your baby is inside the uterus. Some odd times it happens that the baby is not in the uterus but in the tubes or somewhere else in your body, which is abnormal, which will cause you to be in very difficult, life-threatening situation. If the baby is not in the uterus and is in the tubes obviously will not grow further and they will burst at some point, putting your life in danger. So we need to rule that out, right? So once all this is being ruled out, we see all the baseline tests are normal. The next visit after 12 weeks would be at 20 weeks.